my name is Ashika Brinkley. I'm the Program Director of Health Science and Public Health at Goodwin University. I would like to talk a little bit about our program. As you know, public health is a hot topic in the media right now in the midst of the COVID-19 crisis. But public health is so much more than that. Public health is health policy, public health is risk communication, public health is epidemiology, which deals with the collection and interpretation of data. Public health is statistics, public health is occupational health and safety, ergonomics is a part of public health. There are lots of different areas of our lives that are touched by public health. And more importantly, when nothing bad is happening, most of the times it's because public health is working effectively in the background. And so we bring all of these conversations to the classroom at Goodwin University. And I have Holly, who is one of our shining stars, who will talk a little bit more about her classroom experience.
Hi, I'm Holly Zamagita. I'm an MPH student currently here at Goodwin University. And I love the public health program because you learn from everyone's life experience and that it comes down to public health being an imperative thing to have communication skills, to have empathy, because you're dealing with, local communities that need you to understand what's going on in their lives. And no one has a life that is the same as the other. Every experience is valuable. And so in our discussions, we talk about our personal lives, we talk about our own health experiences and dealing with doctors. So I have to say, if you're wanting to be in public health, this is the time. This is definitely the time to learn from your professors, to expand your knowledge, to become someone that can step into the world and easily, connect to the people, regardless if you know them, for decades or just that first time meeting them.
One of the great things about the Master of Public Health at any school, but at Goodwin University, is that it doesn't matter what major you had in undergrad. There are so many different places that you could land in public health, that whether you are an English major and you're going to bring your risk communication or communication skills to the field, or you had more of a sociology, politics, policy background, you can bring that to the field. If you are a math geek, there's a place for you in biostats and FE. There's so many different areas that you can land, and so that's what adds to the richness of the classroom. People come from all different backgrounds, all different countries, all different majors, and all different levels of life experience. And public health is all about interdisciplinary problem solving. And so all of those different perspectives are so important. And I'll let Jeff Catlett, who is one of our adjuncts, talk a little bit more about what it's like on the ground and what are some of the skills that are needed in the field right now.
Thank you, Ashika. My name is Jeff Catlett. I'm an adjunct instructor. I'm also a local health director here in Connecticut. It's a very exciting time for public health. There's a high demand for advanced degrees and a real specialized skill set, especially during a pandemic. The current workforce is aging, and there's a tremendous amount of retirements on the horizon. There'll be a huge gap in filling those positions with individuals. And I think what Goodwin University offers is a real world experience, real world internships. You're not just learning from a textbook, but you're talking with individuals that have experienced what they're talking to you about. I think one of the unique things about this is that when you begin your journey with Goodwin, you just don't have one class with a student. I've interacted with students since the beginning of the program, even though they're not my students. Still keep in contact, check in on their career goals, their career thoughts. And really, I think it starts with building your network in the public health community. I think there's a sense of pride, and I think as an instructor, I get a real sense of accomplishment when the students accomplish things with the MPH program.
Absolutely. And, relationship building is such a big part of public health. Those people skills. So many of our students want to make a difference in their local communities. So the students who started last fall will be graduating in December, and any of them could jump right into any public health job right now. You think about our local health departments. Connecticut is decentralized, which means that just about every town has a health department. So you think about all of the jobs that will have openings and all of the opportunities for a new generation of public health leaders, because they have the skills, they have earned the skills, and taken some of their interpersonal skills and soft skills and married that with formal public health training, and they're ready to do pretty much anything right now. So I'll let our dean, Paula Doud, talk a little bit more about Goodwin University and how public health fits within that whole context.
Thank you, Ashika. So hi, everyone. I am Dr. Paula Doud. I am the Dean of Nursing and Health Professions. And the Masters in Public Health is one of our programs that we were so excited to be able to offer at Goodwin University, because it is so integral to many of our other degrees in health professions. It's not just the content that our students know. They are ready to hit the ground running because they have these critical thinking skills. They have these problem solving skills. So they can get out right as a graduate and get into the workforce of public health and say, how can I contribute to the health and well-being of not only individuals, but populations as well? So I think one of the things that distinguishes our program from a lot of other programs is not that we just focus on the content, which we do, but we also focus on getting our students ready to be productive adults in the field and be amazing contributors. I have every reason to believe that our graduates are going to really make a mark in the world with this master's degree in public health.
Absolutely. And I think one of the things that's also great about the Goodwin classroom is that the students in our program really want to do public health work. We have physicians, we have people who work in the health field, we have people who've worked outside of the health professions, but they're in the classroom because they want to be public health professionals. And I hope that if you're thinking about public health, now is the time. There are jobs, there are lots of opportunities, and Goodwin University would be a good place for you to explore that. So hope that you consider applying to our program and visit our campus and talk to our students and faculty, and it will be a great opportunity.